Okay. Okay. So now, as the aorta is leaving, we got time? Yes. Because I want to show one more video before we leave. It's gonna tie all this in together. All right. As the aorta is leaving the heart, there's small vessels that branch off from it, and they literally just go over the heart. Like they go over the heart. Okay. We're almost done with the lecture. Okay. Write down the name for these vessels. So these vessels are called, put it all the way over here because I already have them over here, are called coronary arteries. These are different because they're going away from the heart, but they're going right back on the heart. With these coronary arteries, this is how the heart itself gets fed oxygen. Okay? So the coronary arteries feed the heart itself. With oxygen, with O2. Okay? So literally, just imagine that this hand is a heart. Okay? And this arm is the aorta that leaves from the inside of the ventricle. This arm, right? And my fingers are like the coronary arteries that go over the heart as the aorta is leaving. Okay? And then as the aorta is leaving, blood is going out to the aorta. I'll put that thing there. It's going out to the aorta, but obviously, because blood is pumping out, it's going up, and it's also going here. Okay. Your other note, why these are so important, and this is where we tie in the video, is that whenever there's a heart attack, the problem is in the coronary arteries. That's a heart attack, okay? A heart attack, when there's a heart attack, the problem is in the coronary arteries. All right, problem is in the coronary arteries. And all that means is that there's a blockage. Okay, so if there's a blockage in one of these, that's the heart attack. That's a heart attack. Okay, so heart attack. So this should all be like one note right here. You guys should chunk this up into one side note. So, and then a heart attack. We know that if there's a heart attack, the problem is in these little arteries right here, right? That's the problem. What's really going on inside is there's a blockage. That's it. It's a blockage. Blockage in coronary artery. And then we kind of went over some of the drugs last time that they'll need, nitroglycerin and aspirin, right? So blockage in coronary Okay, so if I have a blockage here, this coronary artery is going to feed this part of the heart, right? But what if I have a blockage? What's going to happen is the blood going to go through there?
No, that part does.
No, right? So then if the blood's not getting through there, what's not getting through there? What does the blood carry that we care about?
Oxygen.
Oxygen. So now this part is going to start to die. All right? And that's when they get chest pain. So this is why they get chest pain. Just how that patient up there in the TV, how he had that chest pain. The chest pain was because there was no oxygen getting to a part of the heart, so the heart was acting up. It acts up by showing pain. It's like if I were to not feed you for a month or give you water for a month, you're gonna start acting loopy and start acting up, right? It's just a normal thing. You're gonna start being delusional and not thinking right. Well, that's kind of what the heart's doing by giving you pain. It's not acting right. because it's a part that's dying. That's
In
literally
the video,
dying.
it showed like I want to say like a bump forming inside his vessel.
Yeah, and
What are
that's that blockage right there.
What exactly are they called? Like, how do you get those?
So you get that from a really bad diet. You get that from eating too much bread, too much tortillas, too much sugar. Because sugar, we don't need sugar. That's the one thing we don't need in our body.
Fast, or no?
It happens over time. So now, like when somebody is overweight from eating too much carbs,
You don't get me.
too much carbs, what happens is that the fat doesn't just get stored in, like around your belly and around your organs. It gets stored everywhere, even inside your vessels. And when that happens here, that's when it's a problem.
Oh, so that's what that layer was.
It's stored fat, yeah, and the stored fat. So that's why, like a lot of people that have diabetes, they have diabetes because they eat so much bread, tortillas, sugars. They'll eventually, not for sure, but there's a good chance they're gonna have this because all this is fat from eating too much carbs. And that's the problem with diabetics. You're diabetic because you eat too much carbs. So you're showing too much sugar. You're making too much sugar in your body, and you're already eating sugar that's already made. So you're like really shocking your system. Your pancreas can't make enough insulin, and so it just stores that sugar as fat. Fat is stored sugar. That's all fat is. It's just too much sugar, but your body makes sugar when you eat bread. It makes its own sugar. So you don't even need to eat sugar. That's the one thing we don't even need in the body. Okay, just so you guys know. Any questions about any of this stuff? Okay, so we went over the physiology, how it normally works, and then we went over a heart attack, what that patient was having, okay? And the heart attack happens when there's a clot in the coronary arteries. The coronary arteries feed the heart itself. That's why the heart gets fed, okay, as the aorta is leaving. So what I'm gonna do now is we gotta take a picture of this, go ahead, and then I'm gonna show you guys a real oversimplified video that's gonna hopefully make this easier in case you guys had issues with my lecture. Okay? That's pretty cool, right? Easy? That's what I mean?